My name is Olivia Freer, and I am a first year in the Child and Youth Care program. I decided to choose CYC. I started out as a SWAC student to finish off my high school diploma. I made a few connections along the way that got me interested into the Child and Youth Care program based on my interest in mental health and mental illness. I am going to be demonstrating a couple of grounding techniques that are meant to assist you when you are feeling anxious, elevated, overwhelmed, or stressed. The first technique I am going to be demonstrating is the 5-4-3-2-1 technique. How you begin this is by finding 5 things you can see, and that can be anything. It could be the sky, it could be birds, it could be the carpet or some color. 4 things you can touch. It could be the lining of your coat or the way that your sock feels on your toes. 3 things you can hear, people in the hallways, or if you hear a frog or something. 2 things you can smell, which I really hope it's a good smell. And 1 thing you can taste. Well, like right now, I had a bagel before I came in here, so I'm tasting urban garlic cream cheese. The other technique I like to use, because I am a very sensory-based person, I simply run my finger along the inside of my fingers. I will go back and forth, different speeds, different pressures, and I find it is very helpful to focus on this sensation as opposed to my internal feelings. I really enjoyed sharing these techniques with you, and I really hope that they can help you or someone you love in the future.
Hi, my name is Matthew High. I'm a second-year practical nursing student at Lambton College. I've always wanted to be in the medical field, and I found that practical nursing was a great stepping stone into the field. Today we're going to be going over some of the steps on how to perform a sterile dressing change. She has a bit of a wound on her arm. This is what we're going to be dressing today. Going to measure to see how big the wound is. This end is sterile, so that's not going to touch anything other than, for instance, the sterile side here. Take off my clean gloves. Now I'm going to don my sterile gloves. Just like that, my hands are now sterile. These cotton balls are now saturated, so I'm going to carefully dry them out, and then I can begin to actually clean the wound. And then this appears that it's going to cover the dressing just fine. And I'm just going to tape down the sides. So I'm going to write and date what is, the time, who I am, and everything. Thank you for watching our video. I hope that you've learned something interesting today and that you'll consider practical nursing in the future.
Hi, my name is Bayley Martin. I'm a first-year student in the PARAMEDIC program at Lambton College, and I chose this program because I wanted an exciting career where I could help people. Today I'm going to be performing a rapid trauma survey, which is an assessment we do on our trauma patients in order to rule out life-threatening injuries. So we start with checking our patient's ABCs. So we're going to check their airway, we're going to check their breathing and their circulation, so their pulse. And we start with the head. So it's a head-to-toe assessment. So we're feeling for any obvious injuries, looking for any obvious injuries, move down toward the neck, look for injuries in the chest, and all the way down the sternum. And I'm going to ask my patient to take a deep breath. And we're going to make sure that their chest is rising equally. And then we take out our stethoscope and we're going to listen to their lung sounds. So we're going to ask them to take a deep breath, and we're going to do this 4 times, checking each side. And 2 more. And after that, we're going to move down to their abdomen, so quickly just feel for anything there, as well as their pelvis. And then we grab their pelvis as well, rock that back and forth and in the center to feel that it is stable, because that's a serious injury as well. We're gonna move down the legs, checking for serious injuries, and each leg asking if they have any pain as well. And then we're gonna ask them if they can feel us touching them and if they can move their feet and check for a pulse in their extremities as well. The same thing with the arms. We're going to be moving down the arms, asking if they feel any pain or if they have any injuries that are obvious to us in the arms. I'm just going to ask my patient to squeeze my fingers, make sure they can still move their hands, ask them if they can feel me touching as well. We can check their capillary refill, so checking if they still have circulation in their hands as well. After that, with a partner, we would roll the patient and check for pain in the back, and that is how you do a rapid trauma survey to rule out any life threats. Thank you for watching. I hope you learned something new today.
My name is CARMELLE. This is my third year in the pharmacy technician program. I decided to choose pharmacy technician as a career because I always wanted to work in the healthcare department. As a pharmacy technician, you can choose to either work in a hospital or retail pharmacy. There are different jobs opportunity for pharmacy technicians. Today, I will be showing how to pack unit dose using the PARAMEDIC machine. To begin with, you would find a drug that is being prescribed to the patient. So let's say the drug was pantoprazole. You go to the machine and insert the drug ID number. And on the screen, the drug will appear. You just click on add the drug and how much you would like to package. So let's say we want to package 5. We just insert the number 5 into numbers of pills. How to package the unit dose. Pantoprazole, and this is how it looks. If you are interested in our pharmacy technician program, you can visit the Lambton College website for more information.
Hello everyone, my name's CARLIE Duncan. I'm in my second year of the Occupational Therapist Assistant and Physiotherapy Assistant program at Lambton College. I decided to choose the program that I'm in because as an individual growing up, I loved to play sports. That also led to a lot of injuries. I often attended physiotherapy. I loved that they were able to get me back to the sport that I loved playing, so I want to be able to help others regain function in life. Here with me today, I have a few different assistive devices that can be used in occupational therapy. First, this is used for sponge bathing, so this is used to just clean yourself up if you're unable to. This is a shoe horn, just to help put on your shoes. This device is a hook you can put your foot in, and you can help pull it in and out of bed if you just had a hip replacement. This reacher is used to help pick up things so that after hip surgery you're not bending over too much. If you need to lean forward and you can't reach something, this is a handy tool to help pick things up. This is like a little bit of a hook. You can pull your pants down with it, pull them up. And this is a sock aid, and it's used to help put your socks on. Now I'm going to be showing you an exercise that is commonly used in physiotherapy. This exercise is called quads over roll. It's used after a total knee replacement to help strengthen your quadricep muscle. So I would often take a roll and place it under your knees. You're gonna start after surgery by using no weights and just focusing on your body weight. You're gonna bring your foot up and then come back down. And often you would start for 3 sets of about 5 reps. As you get stronger, you can add ankle weights, which wrap around your ankles. As you progress, you can continue to add weights until you get back to your desired baseline. If you're interested in any of the programs that you guys have just seen, go check out Lambton College's website for more information.